There's something affecting millions of seniors right now, something that causes shame, isolation, and suffering. Yet almost nobody talks about it openly. Not with their doctors, not with their families, sometimes not even with themselves. Today I'm breaking the silence on a struggle that's far more common than you think. If you're a senior, you need to hear this. If you're caring for one, you especially need to hear this. Let's talk about what no one wants to talk about. The silent struggle is depression and mental health challenges in older adults. I know you might be thinking, that's it? We talk about depression all the time now. But here's the truth. We talk about depression in young people, in working adults, even in new mothers. But when it comes to seniors, there's still a wall of silence. Why? Because there's a dangerous myth that depression is just a normal part of aging, that it's understandable to be sad when you're old, that seniors should just accept feeling down because, well, what do they have to be happy about? This myth is killing people, literally. Depression in seniors is vastly underdiagnosed, undertreated, and misunderstood, and the consequences are devastating, not just emotionally, but physically. Untreated depression worsens chronic diseases, increases pain, accelerates cognitive decline, and significantly increases the risk of suicide. Let me be clear. Depression is not a normal part of aging. Sadness about losses is normal. Grief is normal. But persistent depression is a medical condition that deserves treatment. So why don't seniors talk about their mental health struggles? First, generational stigma. Many of today's seniors grew up in an era where mental health issues were shameful, where you were told to toughen up or pull yourself together. Admitting depression felt like admitting weakness. Second, they don't recognize it as depression. Seniors often experience depression differently than younger people. Instead of saying, I feel sad, they might say, my back hurts, or I'm always tired, or I just don't have energy anymore. Depression in older adults often shows up as physical complaints, irritability, or loss of interest rather than obvious sadness. Third, they think it's justified. Of course I'm depressed, my spouse died, or I can't do the things I used to do, or I'm a burden to my family. They believe their feelings are rational responses to circumstances rather than a treatable condition. Fourth, they don't want to burden anyone. Seniors often feel they've already taken enough from their families. They don't want to add mental health concerns to the list of things their children worry about. And fifth, they're afraid. Afraid that admitting depression means they're losing their mind. Afraid they'll be put on medication with side effects. Afraid they'll lose independence or be sent to a facility. All of these reasons keep seniors suffering in silence when help is available. Let me tell you what this silent struggle actually costs. Depression doesn't just make you feel bad, it changes your body and brain. Research shows that depressed seniors have worse outcomes with chronic diseases like diabetes and heart disease. Depression literally makes physical illnesses harder to manage and recover from. Experience more physical pain. Depression amplifies pain signals in the brain, making arthritis hurt more, making every ache feel worse. Have higher rates of cognitive decline and dementia. The connection between depression and dementia is so strong that untreated depression is now considered a major risk factor, face dramatically increased suicide risk. Seniors, particularly men over 75, have one of the highest suicide rates of any age group. Depression is the primary driver. Lose quality of life. They stop doing things they love. They withdraw from family. They lose interest in food, hobbies, connection. Life becomes something to endure rather than enjoy. And here's what's heartbreaking. Most of this is preventable and treatable. How do you recognize depression in yourself or a loved one? Look for these signs that last more than 2 weeks. Persistent sadness, emptiness, or feeling like life isn't worth living. Loss of interest in activities that used to bring joy. Hobbies abandoned. Friends not called back. Favorite TV shows ignored. Changes in sleep. Either sleeping much more than usual or lying awake at night unable to sleep. Changes in appetite. Eating much less or sometimes eating more as comfort. Unexplained physical complaints. Constant headaches, digestive issues, pain that doesn't have a clear medical cause or doesn't respond to treatment. Fatigue and low energy that's beyond normal tiredness. Everything feels like it takes enormous effort. Difficulty concentrating or making decisions. Memory problems that seem to get worse. Irritability or agitation. Some seniors, especially men, express depression as anger or frustration rather than sadness. Withdrawal from social activities and family, increasing isolation, statements about being a burden, about wanting life to be over, or about death being a relief. If you see multiple signs, don't dismiss them as just getting old. They're red flags. So what do you do if you or someone you love is struggling? First, talk about it. Bring it into the light. If you're a senior experiencing these feelings, tell your doctor. Say the words, "I think I might be depressed." If you're a family member, gently express concern. "Mom, I've noticed you seem different lately. Can we talk about how you're really feeling?" Second, get professional help. Depression in seniors is highly treatable. Options include therapy, particularly cognitive behavioral therapy, which works extremely well for older adults, medications, which can be very effective when properly managed, support groups where seniors connect with others facing similar struggles, and lifestyle interventions like exercise, which is as effective as medication for mild to moderate depression. A geriatric psychiatrist or psychologist who specializes in older adults understands the unique aspects of late-life depression. Third, address underlying issues. Sometimes depression is connected to unmanaged pain, medication side effects, vitamin deficiencies like B12 or D, thyroid problems, or other medical issues. A thorough evaluation matters. Fourth, create connection. Combat isolation actively. Regular social contact, even brief phone calls, makes a measurable difference. Purpose matters too. Volunteering, caring for a pet, being involved with grandchildren. Fifth, be patient and persistent. Treatment takes time. The first medication or therapist might not be the right fit. Keep trying. Recovery is possible. Here's what I need every senior watching this to hear. Your mental health matters just as much at 75 or 85 as it did at 25 or 45. Depression is not weakness. It's not failure. It's not something you caused or deserve. It's a medical condition with real treatments that work. You deserve to feel joy, purpose, and peace, regardless of your age or circumstances. You deserve support, compassion, and proper care. And to family members, your loved one's mental health is as important as their physical health. Watch for the signs. Ask the hard questions. Create safe space for honest conversation. Depression might be a silent struggle, but it doesn't have to stay that way. Breaking the silence starts with conversations like this one. If this video resonated with you or helped you understand something you've been struggling with, please give it a thumbs up. Share it with someone who needs to hear this message. And please comment below. What can we do as a society to better support senior mental health? Or if you're comfortable sharing, what's helped you or a loved one through depression? Your story might help someone else. Subscribe to Seniors Health Insights for honest conversations about senior health, the topics everyone faces but few people discuss openly. Remember, you matter, your feelings matter, and help is available. If you're in crisis, please call the National Suicide Prevention Lifeline, 988. You're not alone.